سوري. اسحبني راني طالقة. أوكي. دابا كتسمعوني؟ ألو؟ C'est bon? Okay, okay, I appreciate really your time today as we delve into a critical medical topic that impacts the lives of many. Obliterative arteriopathy of the lower limb. Before we embark on this exploration, let me paint a scenario for you. Imagine a situation where a person's ability to move freely, perform daily tasks, and maintain a good quality of life is progressively compromised. This scenario is unfortunately a reality for individuals grappling with obliterate arteriopathy in their lower limbs. So, we called also peripheral arterial disease. We will start, inshallah, by the plan. So, for our presentation, we will begin with a clear definition, delve into the cardiovascular risk factor, explore the etiologies, and then focus on the positive diagnosis, both from a clinical and paraclinical perspective. Following that, we will shift our attention to treatment modalities, explore the indication, and finally wrap up with a comprehensive conclusion. So the peripheral artery diseases is a pathology linked to occlusive and/or stenosing lesions, most often resulting from arteriomatous lesions. These lesions first cause a partial reduction in the lumen of the arteries, which called stenosis, and then complete occlusion of the arteries, which called thrombosis. For the cardiovascular risk factor, it includes smoking, high blood pressure, high cholesterol levels, diabetes, obesity, and a sedentary lifestyle. Let's move now to the etiologies. The most prevalent among these is arteriomatous arteriopathies, constituting 80% of cases and commonly affecting elderly individuals with the presence of cardiovascular risk factor. Diabetic arthritis is notably emphasized within this category. Inflammatory arteriopathies are characterized by their occurrence in younger individuals and include conditions such as Takayasu disease, Behçet disease, and various types of vasculitis. For thrombotic arteriopathies involve conditions such as thrombopathic antiphospholipid syndrome and myeloproliferative syndrome. And we also have the last one, iatrogenic arteriopathies, which result from medical intervention, both pharmacological and non-pharmacological. So here, the image shows the progression of arteriomatous arteriopathy, illustrating the distinct stage in its formation. The first one, it's a normal cut section of artery. We have also a tear in artery wall. Fatty material, it's deposited in vessel wall, and a narrowed artery becomes blocked by a blood clot. For the positive diagnosis, first thing, we must question about the age, cardiovascular risk factor, sedentary lifestyle, personal and family history. For the functional signs, we have the claudication, which contain exertional ischemia, onset of pain, stopping after a walking perimeter, a perimeter greater than or less than 100 meters, decubitus pain, resting ischemia, and difficult to relieve with painkillers, and also relieved by hanging. Acute ischemia, rupture of plaque, and then we have trophic disorders which contain ulceration or gangrene. Let's move now to the clinical examination. The first thing we must inspect what? We must inspect the sign of arterial insufficiency like amyotrophy, dry bright nails, pale feet, flat veins. And also, we must inspect the trophic disorders like ulceration and gangrene. I have an images here of amyotrophy, dry and brittle nails, ulceration, and gangrene. For the palpation, we have abolition or reduction of femoral, popliteal, posterior tibial, and pedal pulses. We must also check for aneurysms, pounding, blowing, and expanding masses on an arterial pathway. We must also search for the auscultation, a murmur in arterial pathway. Remember, murmur equal stenosis. The Fontaine and Lierich classification is used to classify the peripheral artery diseases into 4 stages. For the paraclinical, we have the biological metabolic like blood sugar, cholesterol, triglycerides, inflammatory, ESR, CRP, and fibrinogen. ESR, c'est la vitesse de sédimentation. Hemostasis, PT, and platelets, and APTT. C'est TP, and for APTT, c'est TCA. For the infection, we need the NFS. Functional assessment, we need to calculate the index systolic pressure by measuring ankle systolic arterial pressure on humeral systolic arterial pressure. If the index was greater than 1.3, which means incompressible arteries, but if it was between 0.9 and 1.3, it's a normal hemodynamic state. Between 0.75 and 0.9, well-compensated arteries. Between 0.75 and 0.4, moderately compensated arteries, and less than 0.3, it's a severe arteritis. We must also calculate the transcutaneous oxygen pressure, and if it was less than 20, the healing is impossible. The image here shows us the transcutaneous oxygen pressure. If it was between 13 and 15, relative ischemia, and if it was less than 13, it's a severe ischemia. We're moving now to the echodoppler, which have an important role in evaluation and diagnosis. Available and inexpensive, may detect the morphology by the echo and the permeability by the Doppler of the arteries. He also can find the location of the lesions and the number of it. The CT angiography. It plays a crucial role in the diagnosis and the management of peripheral arterial disease. This non-invasive imaging technique provides detailed visualization on the lower limb blood vessels, accurately mapping arteries and identifying any stenosis, occlusion, or vascular anomalies. We have now 2 images of CT angiography. The first one on your left, it's a short occlusion of the right primitive iliac artery. And the second one on your right, it's a long occlusion of the superficial right femoral artery. The MR angiography facilitates accurate assessment of the extent of lesions, contributing to a more thorough diagnosis of a peripheral arterial disease. Its non-invasive nature makes it an ideal tool for monitoring and following up patients, offering a safe and effective alternative in the overall management of this vascular condition. Like you can see here, it's a pre-occlusive stenosis of the primary right iliac artery. The arteriography. Arteriography is essential for diagnosing obliterative arteriopathy of lower limb using X-ray and a contrast agent. It provides a direct view of the blood vessels, accurately identifying problems such as narrowing, often used to guide immediately interventions such as angioplasty. It remains a key tool despite its invasive nature, improving the management of the peripheral artery disease. Let's move now to the treatment. The goal of the treatment is to improve walking perimeter, avoid amputation, revascularize limbs, control cardiovascular risk factor, and also control and treat other vascular disorders, of course, like coronary, carotid, or renal. For the means of the treatment, we have the lifestyle, of course, it's to stop smoking and walking, and we have the medical means, which control and treatment or cardiovascular risk factor by correction of metabolic disorders, treatment of hypertension. And we also add antiplatelet agents, anticoagulant, fibrinolytics, and arterial vasodilators. For the surgical means, we have endarterectomy and bypass surgery. The bypass surgery by aorto bifemoral or femoral-popliteals or extra anatomical, like femoral or axillofemoral. For the amputation, we have minor with preservation of support, and we have major without preservation of support. I have here an image to explain endarterectomy. It's a surgical removal of arterial plaque to improve blood flow, as you can see at this image. For the bypass surgery, to understand more, we have here two types of image. The first one, it's bypass surgery by femoral popliteal, and the second one by aorto bifemoral. I have an image who shows very clear the aorto bifemoral by bypass surgery. Here, as you can see, aorto bifemoral. Now let's move to angioplasty, used to treat obliterative arterial disease of the lower limbs. It involves widening narrowed or blocked arteries using an inflatable balloon inserted through a catheter. This procedure improves blood flow to the legs, relieving symptoms such as claudication and pain. It can also prevent serious complications such as a gangrene and amputation. You can, the image here shows the angioplasty with the balloon and have an important role to improve the blood flow. Another image here. We have a superficial femoral artery stenosis, as you can see here in the image, and angioplasty with stenting of the superficial femoral artery. Here, the stenting. And here, a satisfying result. Now we have the indication of the treatment. If you remember, we talked about the classification of Lierich and Fontaine, and which include 4 stages. So the stage 1, we control the risk factor, like the diabetes, high blood pressure, dyslipidemia, also the lifestyle, smoking, by cessation and psychological support, and also walking. For the stage 2, we add the antibodies agents. For the stage 3 and 4, we have the anticoagulant, arterial vasodilator, antalgic for pain relief, antibiotherapy and local care, and limb-saving surgery, often by a distal revascularization. If the revascularization fails, we move to the amputation. So by finishing this presentation, the peripheral artery disease is a frequent pathology. The etiology dominated by atherosclerosis, easy clinical diagnosis, and high performance paraclinical examination. Wide range of treatment, and the best treatment it's the prevention. Thank you for your attention. If you have any question.